Good afternoon, everybody. My name is Congressman Mark Takano, and I represent the people of Riverside, Moreno Valley, Jurupa Valley, and Paris in the United States House of Representatives. I'm speaking to you tonight from my office at the United States Capitol about a very important subject, the coronavirus pandemic that has spread across the world and struck the United States. For the last 2 weeks, I've been in Riverside County where I stayed in touch with local health officials and my constituents about the progression of the disease in our community. Today, I flew back to Washington, D.C. to vote tomorrow on the passage of a $2.2 trillion emergency stimulus package that was negotiated by the Democrats and Republicans in the Senate earlier this week. This package contains funds to support small businesses, to expand benefits to unemployed Americans, and to send checks of up to $1,200 per adult and $500 per child to most households in our nation. This bill is the third congressional action meant to address the coronavirus. 3 weeks ago, the President signed an $8 billion bill authored by House Democrats that provided funds to purchase emergency medical supplies. Last week, the Senate passed the Families First Act, authored by the House Democrats, that provided $100 billion to help workers, families, and small businesses that are struggling from the economic effects of the pandemic, and to make coronavirus testing free for every American. Tonight, I will answer your questions about the government response to the pandemic, and I will be joined by Dr. Edgar Bulloch of Borrego Health, who can answer questions about the virus itself. If you would like to ask a question, please press 0 on your phone, and you will be put into our question line. We will have many people on the call tonight, and we may not get to every question. If we do not reach you by the end of the call, you will be given the chance to record your question, and it will be forwarded to a member of my staff. We also have questions that have been emailed in from my constituents over the past few weeks that we will provide answers to. Before we begin, I'd like to give Dr. Bulloch a moment to introduce himself. Dr. Bulloch, thank you for joining us tonight. Go ahead.
Yeah, thank you very much, Congressman Takano, for having me here. It truly is an honor. My name is Edgar Bulloch. I am a physician at Borrego Health, and I am the chairman of the COVID task force in charge of coming up with our company's organizational plan to combat this virus. I am here to answer any questions that you have regarding the virus, testing, and what our strategic plan is at this point.
Okay, so let's get at this. Let's get to your questions. Again, press 0 if you'd like to ask a question during tonight's town hall. Again,
Congressman,
go ahead.
Yeah, Congressman, one of the most common questions we're receiving is how many people in the United States and in Riverside County presently have this disease?
Why don't we, Dr. Bulloch, do you have the latest numbers on Riverside County?
I do have the statistics. For Riverside County, there's currently 44 confirmed cases of coronavirus. There have been 0 deaths in western Riverside County. In southern Riverside, there's 19 confirmed cases also with no deaths. And this was updated as of this morning at 10:30.
And originally, as I understand it, COVID-19 virus showed up in the eastern county first. But now I think there have been so unfortunately some deaths associated with COVID-19. But in the western part, in Riverside, we now I think exceed the number of confirmed cases in East County. Is that correct?
Yes, sir. The confirmed cases in the eastern Coachella Valley are 41 confirmed cases, and there have unfortunately been 7 deaths over there.
Wow. That's really heartbreaking. Let's go on to the next question. Remember to press 0 if you have a question that you want to ask. So Brian from Moreno Valley, you have a question about the stimulus bill. Go ahead, Brian.
Yeah, hi. I was just calling in today because I know a lot of Americans are wondering about this right now, and especially with a lot of talk going on around. I'm just wondering, a part of the stimulus package, you said that every adult could potentially get $1,200 check or some type of payment. I'm just wondering exactly how long is it going to take the U.S. government to process those payments, and like what is going to be the method for that? Because I know there's like a lot of confusion with that. Like, is it going to be in the form of a tax rebate, or what is the exact way they're going to go about doing that? Is my question.
Brian, thank you for that question. I know people are worried about meeting their own household expenses. My understanding is that the Federal Treasury Department, is going to do this for people who have filed tax returns in the previous year, in 2019, that the goal is to get this $1,200 check or checks out, these rebate checks out to people immediately. And I think it comes faster for those people who have filed electronically and have bank accounts set up. For others, the paper check may unfortunately take a little longer. But the goal is for those people who have filed electronically that the rebate checks come out by April. Let me be clear that these $1,200 one-time payment per adult. So if there's a spouse, there are two people in the household, and they're married, they can, and each earns up to $75,000 a year. That they are below that amount. The maximum payment is $1,200 per adult. So a household of two adults and no kids can receive $2,400. After that $7,500 individual threshold, the amount for the rebate starts to decline. It starts to go down by about $5 for every $100 that you earn over $1,200. And if you earn and at $112,500, the benefit just is capped out. If you earn over that amount of money, you're not going to get any rebate check. You're not going to get any rebate check at all. If you're a head of household, say you're a single mom or a single dad with kids, you have that threshold is raised from $75,000 to that $112,500 for those head of households. So you are still eligible for the maximum benefit of $1,200 if you're a head of household. So if you're a head of household, you can earn up to $112,500 for that maximum benefit of $1,200. And if you are a couple and you're joint filers, you can earn up to $150,000 and receive the maximum benefit. And you get a $500 per child who is under 17 years of age. That's another part of the rebate check you would get. Of course, we'll be watching very carefully how this unfolds, but my best answer is for those of you who filed electronically in the past, that'll be you'll receive the checks the quickest, and for those who don't have all that infrastructure set up, you're going to get a paper check later than that date, probably towards May. Allison from Moreno Valley. Go ahead, Allison.
Howdy. So I think like a lot of young adults, we are faced with this great uncertainty. I was recently laid off from my own job. I'm a college student and trying to get by.
Yes.
And my greatest concern is like, you know, I had to go try to find a job at Walmart or Amazon or literally anywhere.
Yes.
And when can we expect some level of normalcy and like for things to calm back down, you know? And I know that there's maybe not an answer to that, but, you know.
Yeah. Allison, that's on the minds of everybody. So this virus is very serious, and I think you're sensing how serious this virus is, and young people are not exempt from the serious health consequences. Less of them are afflicted in the same way that people over the age of 60 and 65 are. But I've known of people in their 50s, in their 40s, who've actually died from this disease. And if you don't die, there's at least 20% of the population that gets very seriously ill and overtaxes our health system. And what young people may overlook is they think, well, this doesn't affect me, but it affects you in indirect ways. If the health system is overtaxed and fully consumed with taking care of people with the COVID-19 virus, there are other health services that you simply are not going to be able to access in a timely way. Now, I do want to let you know that there are $600 in emergency benefits for 4 months for those who are eligible for unemployment. So what the Senate bill does is it enhances unemployment benefits. And unemployment benefits are used as a program that's jointly funded by the state and the federal government. If you've been working, even if it's part-time, it's likely that you've been paying into the unemployment fund, and so has your employer. So that's how unemployment insurance is funded. The federal government usually pays 50% of your normal unemployment. So you should definitely look at applying for unemployment insurance. There should be no hesitation to do that. There should be no stigma attached to it. This is an extraordinary moment, and it's nobody's fault that you have a coronavirus that has undermined and wreaked havoc on our economy. So the $600 for unemployment insurance from the federal government is on top of whatever unemployment you qualify for locally in the state of California, and then you're also going to be eligible for up to $1,200 in a rebate. And there's other things for students. So if you had to leave school early and you have half of your Pell Grant that was already paid out for school, or you expended some of your Pell Grant in this quarter or semester, you're not going to be obligated to pay that back to the government. And there are also measures being taken to allow you to get forbearance on your student loans and not accrue interest on the principal. Valerie from Moreno Valley, you are experiencing some symptoms of COVID-19. Go ahead, Valerie. Valerie, are you there? Are you still on the line?
Can you hear me?
I can hear you now,
Hello?
Valerie. Valerie?
Okay, hi. Hi, how are you?
I'm good.
Everyone that's on.
My understanding is you think you might have symptoms of COVID-19?
No. I was asking regarding the symptoms. They're changing. It appears they may be changing daily. You may have, the questions that they're asking, do you have a worsening cough, a fever, or shortness of breath? But is there maybe a milder symptoms that can go to worsen, to go to those cough, shortness of breath, and the fever?
Dr. Bulloch, we have a doctor on the line. Can you address that?
Right. Yes, Valerie. So, unfortunately, with coronavirus, the symptoms vary widely amongst the different people that it does infect. And so, the majority of people that do get affected with coronavirus, about 81% of people are going to experience mild symptoms. The most common symptom prevalent amongst all of them is fever, but also accompanied by cough and shortness of breath. And so, it doesn't have to be that you have to fit all three criteria to be diagnosed with the condition. And so, and it could be an evolving disease as well. So you can start feeling mild cough, and then it slowly gets worse, and then you spike fevers. But there's no classical presentation, which makes it a little bit challenging to diagnose. So I would suggest if you start feeling symptoms, there are numerous nurse triage lines that you can call to ask what you should do in that condition. Our attempts are to avoid going to the emergency room for mild symptoms. We don't want to overload the emergency rooms for evaluation for mild symptoms. So if you have mild symptoms, the recommendations are for you to just kind of sit at home and isolate yourself. If they start getting worse, then call the nurse triage line. If it does come to the point where it's a medical emergency, then call 911. But there's these nurse triage lines that have a vast amount of information that you can get from them. So
doctor, let's stay on the line, and Valerie, if you're still there. Valerie, I heard Valerie is not there anymore. But doctor, let's talk a little bit about this. I want to revisit. I want to kind of focus on these triage lines, these nurse triage lines. Second, people who may have mild symptoms or may be asymptomatic and have this. And of course, if you're asymptomatic, you don't know at all. You don't have any suspicion at all that you might have it, and that's the reason why we are doing social distancing, is to avoid contact with as many people as possible, so that the disease is not communicated to other people. But let's talk about the nurse triage lines. I think I think we've put those triage lines, the numbers for people to call if they have symptoms, to be screened by a nurse. That's what we mean by a nurse triage line, right, doctor?
Right. So there's several triage lines that you'll get connected to a registered nurse, and those nurses are trained to assess for mild versus severe symptoms. So if you have more of the mild symptoms, they'll be able to refer you to a clinic for evaluation if need be. If they recognize that it might be a more severe symptom presentation, then they'll have you call 911. But yeah, there's several throughout Riverside. Our clinic in particular actually has a text line that you can text COVID to 52304, and you'll be able to get information on COVID or get connected to one of those nurses, and they can help you figure out what your symptoms are and if it's something that you need to come in for evaluation for.
So repeat that text again, doctor.
So text COVID, COVID, to 52304.
So 52304 is what they text, and then they just type in COVID. Is that right?
Yes.
Okay.
Yeah. So if you do that, you'll get an automatic response asking you for what information you're looking for. If you want just symptoms of COVID, what to do if you think you have COVID, what precautions you can take to avoid getting COVID. So it's a very helpful line.
Doctor, right now I'm struggling not to scratch my face. I want you to know that. I mean, I don't know about you, but I find it really hard to not touch my face. This is one of the things we're not supposed to do, right?
Right. Yeah, it's very difficult. It's a habit that we don't really recognize it, how often we're doing it until we're actually catching ourselves doing it. So, yeah, some of the things that you can do to avoid COVID: always wash your hands, especially if you're somebody that likes to touch your face or inadvertently find yourself touching your face often. Avoid the mouth, the nose, the eyes, and washing with soap and water for 20 seconds, or using a antibacterial lotion.
Yes. Do you have any tricks that you have that you use to stop touching your face? I don't hate to put you on the spot, but
Not particularly, not that I can think of. I mean, people are wearing masks these days too, and that's one way. It's a barrier, right? So if you have a mask in front of your nose or mouth, then you're not actually going to get any contaminants into the mouth or nose. But I mean, the eyes are something that people also touch a lot. So I can't really think of any techniques off the top of my head that you could do, but perhaps the mask will at least decrease your risk of getting any viral particles into your mouth or nose.
Of course, frequent hand washing will help minimize, even if you touch your face. I mean, if you've washed your hands over and over again, it minimizes that you're going to have stuff on your hands, which will get on your face. But we got to do both.
Absolutely, yeah.
Okay.
Absolutely.
Adriana from Riverside, you want to ask a question about benefits for mixed status families. Go ahead, Adriana.
Hi. So I was wondering, like, for example, in my situation, my mom's a single mother, and she's in process of getting her residence, but it's still in process, right? So she was recently laid off. I was wondering if there was going to be any help for families that, for example, in my situation, what would be the help we would get if she's the head of the household and she was recently laid off due to the coronavirus? Like, what help to...
So is your mom, before you go, is your mom a permanent resident or...
no, she's in proceedings.
She's in proceedings, so she's applying for becoming a permanent resident? She's undocumented right now?
Yes, she's currently applying.
Okay. So let me tell you that the Democrats in Congress really fought hard on this Senate compromise to get people who are in this country and who are working, and she was working, eligibility for unemployment and also eligibility for the $1,200 rebates. Undocumented people currently are ineligible because they made the requirement that everyone have a Social Security number and not the number that undocumented who are in this country can use. I want you to know that we're going to be fighting for greater inclusion in future bills. This is not a topic that's over. It's not right that people who have worked in our community, who have contributed to our community, be left high and dry at a time when we need to make sure that nobody in our community is left behind. That this virus does not discriminate against anybody. It infects citizens, non-citizens, permanent residents, dreamers, everyone alike. And in the United States of America, we need to be united in fighting this virus and to slowing its spread down, so we minimize the number of people who get sick and minimize the number of people who die from this disease. So, Adrian, I want you to know that I'm fighting for you and your family.
And just to piggyback on the medical side of that, Adriana, if you don't have insurance or your mother doesn't have insurance or falls short of insurance, there are federally qualified health centers such as Borrego Health that work on a sliding fee based on income so that we can get the necessary evaluations that you need. So always keep that in mind if you are falling ill or if your mother falls ill and you need somewhere to go. Search out your federally qualified health centers like Borrego Health.
Doctor, thank you for that point. That was wonderful. James, you're from Lake Matthews. You want to ask the doctor a question about test accuracy. James,
yes.
Are you there?
Yes, I am. Thank you so much, first off, for having this quasi-town hall. This question is kind of directed to the doctor. They're beginning to ask the question now about realistic data elements going into being inputted into a model and then coming out with realistic analysis. The earlier data models now were showing very, very apocalyptic results, millions of people dead and this and that, and now they're beginning to see that that's not the case. And I understand, which is relatively moot for me now, MOOT, that, first we were looking at China, then we're looking at Europe, But now we don't have to look at that anymore. We can look at America. And we have now, well, at least that's what's being promulgated, that we have testing that can actually be done at home now, like a prick of the finger, mail it in, and see if, you actually have the virus or whatever. And then you're getting random sampling at that, in which I think will produce a much more realistic model that we can look to. I don't know if you've heard about these test results, but what I'm hoping, because you mentioned something strategic, that somehow Riverside would kind of get into the forefront of some of this home testing and put itself out there as, look, we've got realistic modeling going on here. We'd like to be a part of the conversation. Does that make sense? Do you understand what I'm saying?
Yes, James. I think we understand what you're asking. Go ahead, doctor.
Yeah, it makes absolute sense. And so, that test in particular has not cleared through the FDA. What our limiting factor at this point is the amount of test kits that we have available. We are in short supply, and so we are looking furiously at ways to get more test kits, because ideally, yes, we do want to test everybody to get a more accurate census of how many people are actually affected and how many other people are actually succumbing to the virus. At this point, there's nothing out there. We have two major labs that are doing the gold standard testing, which is the nasopharyngeal swab. So it's a Q-tip that goes in your nose to collect a sample. So that's all we have, and since we have them in limited supply, we are only able to test truly the most serious cases. So the cases in the hospital or the patients that we think are going to have the potential to have a more severe course of the illness. But yes, I do agree with you. I do think that we need to have more generalized testing in order to get a true consensus of how many people are actually affected. And based on that, if we have a larger denominator of patients that we're able to screen, the death rate that we're actually seeing may perhaps go down. But without the true testing ability to do that, we're unable to. We are trying to look at other ways that we can test besides these nasopharyngeal swabs. There's other forms of tests, nothing that is available for home testing at this point, but we are actively researching. This is a new virus. It's difficult to stay on top and stay current as things are changing on an evolving basis, but I am definitely on your side that I do think we need to bring more testing to the general public so we get a better sense of what's going on.
James, I would add that I agree with it. We need more testing. We need to get to the point where I think you want to go, which is we need to get the capacity to do surveillance testing. Surveillance means we're not just testing the healthcare workers because we want to keep the healthcare workers safe. We're not just testing the people who are in the hospital because we're treating them. You need rapid turnaround tests that get done faster than 2 to 3 days. You actually need that test within hours. And many hospitals have thankfully, a newly approved FDA test on something called the Cepheid machine, which can return a test result within 45 minutes. They're very expensive machines. They're not available. You can't drive up to Dr. Wright to any drive-up station right now and wait around 45 minutes to get that test result back. There's just not enough of those machines, and actually they're shipping out the 60,000 test kits right now to the various hospitals, mainly put in hospitals around the country. What we have now are the commercial high-throughput machines at commercial test sites like not Roche, Quest and LabCorp are the two big commercial platforms. We also have reference lab tests at places like Stanford and UCSF and UCLA. But James, I got to be whatever you're hearing about these home-based tests, they are not approved by the FDA. Please don't fall for sending money to these folks. Right now, there's actually members of Congress who've written to the company that has put out these tests and has actually has actually they may want to investigate for consumer fraud because they are putting out tests that have not been approved by the FDA, and it's so important that we do have valid tests. And it may be a valid test, but it has to go through the FDA approval process, and for them to already be marketing it out to people is not right. What I have heard in a briefing with the Energy and Commerce Chairman is that testing for anybody who wants it is really not going to be possible until June or July. That is not acceptable to me. And I am trying to learn everything I can about testing to see how we can ramp up the availability of tests. There's different kinds of tests that are being that people are applying to the FDA for approval for. But right now, our testing capacity is mainly focused on healthcare professionals and people who actually are seriously ill in hospital settings, and that's why the testing capacity is very is being conserved. So we have now Heather from Paris, who wants to discuss the impact of COVID virus on schools. Heather, are you there?
Hello? I'm here. Yes.
Hi, Heather.
Hi, how are you?
I'm good. Welcome.
Good, and thank you for having this town hall. I'm an educator here in the area, and I'm really concerned about wanting to know, how is the state considering completing this school year? We have children who are athletes, who are supposed to be graduating, who have aspirations to go to the next level, post-secondary. How are we serving those kids, or even just at this point considering? I understand that this is a fluid situation.
It is fluid, and what I do know is that schools are closed for the rest of the academic year, and the authority on school closure is with the head of our public health, Dr. Ken Kaiser. Governor Newsom has indicated that it's unlikely that schools are going to reopen for the rest of this academic year. As to September, I don't know what to tell you. The current bill, the Senate relief bill that the House is going to be voting on tomorrow, has $13.5 billion for K-12 grants and $13 billion for distance learning. I share your, I think, sadness about all of the seniors who aren't going to be able to go to their prom, the juniors and seniors for the junior-senior prom, and the graduations that are hopefully, the graduation ceremonies that are hopefully postponed and not completely canceled. That maybe sometime in the future we can do something to acknowledge the accomplishment of our young people. This is a tremendous disappointment, I think, to young people to have this interruption. But just know that the federal government has approved some money for aid to states and localities, and I'm sure the state of California will be doing more to address some of the pain and alleviate some of the suffering that our young people and our teachers and our educators and everybody involved with schools is suffering. I remind everyone on the line to press 0 to ask a question. We have Brian from Paris who wants to ask the doctor about flattening the curve. Are we doing that? Go ahead, Brian.
Hello, how's it going?
Good. Welcome.
Okay. Once again, I'd just like to thank you guys for having this. And my question was, according to Johns Hopkins University of Medicine, their Coronavirus Resource Center, we have surpassed China in the number of confirmed cases per country and region. And I was just wondering if you guys, or if there's any idea how far along we are on the curve, and if we've reached its peak. And in terms of like the basic reproduction number how much worse is this compared to the seasonal flu?
A couple of questions
That's an
there,
excellent
Doctor.
question. Yeah, excellent questions, both of them. So I'll address the first. Where are we on the curve? Unfortunately, this is very early in its stages of being diagnosed, and while the numbers that we're seeing, as we had mentioned earlier, are probably not truly reflective of the people that actually have it, because we just don't have the ability to test everybody at this point. But I do believe we're probably just at the tip of the iceberg. Social isolation is key. We really need to distance ourselves to stop the spread of it. This is a new virus for humans. We've never seen it. None of us have immunity to it. So that's why if people get it, we don't have any antibodies to it. And so if we all get sick at the same time, it's definitely going to overwhelm our health system. And that's why this social isolation will work if we truly are adherent to it. So staying at home at all times if possible, going out only for the most important things, groceries and healthcare visits, because unfortunately, yes, I think we're barely at the tip of the iceberg and there's definitely more to come. Can we limit it? Can we limit the devastation that it can take? If we take drastic measures by keeping us out from the outdoors for a couple of weeks. And yes, it is a devastation to the economy, but we also need to ensure that we are around for the economy to survive too. So I definitely think that we need to be very adamant about this social isolation and make sure that you stay home so that we can definitely try and flatten that curve so we're not all getting sick at the same time and all overwhelming the healthcare system at the same time.
Doctor, what was the second? Who remembers what Brian? There were two questions he asked. One about are we close to? Have we reached the peak? And you said no, we're not. We're not near reaching the peak. We're very early into this, which is very, I think, harsh news for those of us who are been going stir crazy this last week. And what was the other thing he asked? Anyway, but
yeah, sorry, I forgot his second question.
As far as his second question. Well, here's the thing. There was a wonderful. I saw a little 30-second clip from a public health doctor in New Zealand who said that many of us are in this mindset of behaving as if we don't want to catch coronavirus or COVID-19 from someone else. But really, what might change our behaviors in a significant way is if we assume that we already have the virus and we don't want others to catch it from us. And how would that change the way we behave if we knew that we had a potentially very serious disease that we might have mild symptoms for or no symptoms at all, but maybe carriers? How would we start to behave in a responsible way? Is that a useful way to think about social distancing and the ways in which we might change the way we behave?
Yes, definitely. That's a really good perspective to put it in, is if you actually have the disease and how you can prevent it from giving it to somebody else, one of your loved ones. That's the real behaviors that we should be executing in these key weeks. These are key weeks. If the amount of virus replication and the contagiousness of it continues, then it is going to come to a point where it's too overwhelming. That being said, I don't want to strike any panic into people, and this is a very anxiety-provoking concept. There are also phone lines out there for people that become overwhelmed with anxiety because of the crisis that we're under. The Substance Abuse and Mental Health Service Administration has a disaster distress hotline that if you do start to become overwhelmed or you feel too anxious about everything and you want somebody to talk to, there's a phone number you can call. There's also a text line that you can call as well, and it's a counselor 24/7 that is an expert in crisis counseling. And so if you become overwhelmed by the situation, I encourage you to seek help because this is overwhelming, and so they can help reframe your thoughts so that you don't become too panic-stricken and you focus on the things you can control. So what can you control? You can control staying at home to decrease the risk of getting infected or spreading the disease if you are an asymptomatic carrier.
Doctor, that was so important what you just said, that many people will get anxious and they'll need some counseling, but it's important that we're very serious about this. That we got to be very serious about this. I mean, if we have older parents, probably not a good idea to go visit with them and have dinner parties. We want to encourage, older folks to stay at home. We may need to support them by getting them groceries, encouraging them to use the senior hour to go shopping. But I have Baker from Riverside who wants to ask about Social Security and the benefit checks. Baker, go ahead.
Hi, thank you so much for having this town hall. I was just wondering if I'm on Social Security disability, would I be receiving any type of benefit or should I be expecting anything?
The answer, Baker, is yes. You will be eligible. If you don't file taxes, many people don't file taxes for various reasons, and being on Social Security disability is one of those reasons. You will still have to take a couple extra steps. The Social Security, the SSA folks will give you information to beneficiaries, and the IRS will be doing an outreach campaign through whatever advertising they're going to be doing through, I imagine, through social media or some sort of public campaign to make sure they reach folks like you. And for people on the line, many of you might not have filed a tax return because you had no income. You are still eligible for the $1,200 rebate, and that's really important to get out there. And we'll be sending out information through our emails and posting on our website and social media about this topic. But thank you so much for that question. Very important question. We have Adriana from Jurupa Valley. Your question is about resources for small business.
Yes, hello.
Hi, Adriana.
Hi. So my question is, my husband has a small business, and of course, we're trying to be compliant and help the spread. With him closing his business, we're in a financial crisis right now, trying to maintain that business, afloat by paying the expenses. I did see the email that you sent out offering small businesses a loan with 3.75% interest. My question to you would be, what other type of financial relief can you provide small businesses to keep them afloat during this epidemic?
I'm so glad that if we can keep Adriana on the line, is that possible, Adriana? Because I want you to be able to come back with some more questions with me. So, is your small business smaller than 500 people? Do you have smaller than is it your employee base is smaller than 500?
Yes, it's a barbershop.
It's a barbershop. So it's a and you have like other barbers working for you in there, or you're kind of self-employed, kind of?
It's self-employment, correct. I work in education, but my husband, he's self-employed.
Okay, so for him and for people who might have 10 employees, 50 employees, 100 employees, there is in this bill we have a $350 billion fund to pay for what's called a new Paycheck Protection Program. We call it Paycheck Protection Program to assist small businesses to keep their employees employed. And how they can do that is apply for a small business loan. That loan is forgivable for up to 8 weeks of payroll to employers. Now, what I mean by forgivable is if you keep those employees employed. In your case, you have a self-employment issue. But say you've had 10 employees, you keep them employed. You're going to be able to convert that loan into a grant. And the whole idea is to actually keep people employed and have income coming on, and to have it flow through your small business so that your small business doesn't, go away. We have also incentives for rehiring workers. There's $17 billion to provide relief from SBA loan payments for up to 6 months. We have $10 billion in the bill for the SBA emergency grants for operating costs for up to $10,000. So that may be something. I'm not sure that applies to sole proprietors or self-employed people like your husband. But what I would do is keep looking at what we post on the websites. In your particular case, I'm sure staff are listening in, and make sure you leave your information with us. We're also allowing for, if you already have a small business loan, they're going to allow you to delay those loan payments and not accrue interest on those loans. That's for people who have existing small business loans. And for people who've already applied and got loans, there are ways for them to tap into the grant program, the conversion to grants, if you're trying to keep employees from being laid off. And there's also ways in which you can delay on taxation. You have to pay certain amounts of payroll taxes, and we, for the rest of the year, you get a holiday from those taxes if you're a small business. We're coming up with ways in which small businesses can keep as much cash and prevent a cash flow issue. Do you have any questions about what I just told you?
Where can I obtain all that information as far as any new type of programs that will be given out?
Look in the next few days at my website, takano.house.gov. That's TAKANO .house.gov. And I would recommend, my office is, we don't have people, we're practicing social distancing at my office. So in my Riverside office, everybody's working from home. But we are still checking our emails. And my Washington, D.C. staff is also working from home. We'll be answering constituent questions about these sorts of issues related to small business. We especially want to be attentive to the needs of small businesses, and I'm positive there are ways to help your husband, who's, from what I can tell, is a self-employed person, a sole proprietor. Okay.
Yes, that's correct. Okay. Thank you so much for your time.
Thank you, and stay safe, stay healthy, and keep your spirits up. Araceli from Paris. Araceli, why don't if you're on, say hello.
Yes, I'm here.
Araceli, ask your question. I guess you have a question for the doctor.
Yes, for the doctor. Where can you guide me to go purchase masks, gloves, and sanitizer for my mother-in-law that I'm taking to the doctors? She's currently been diagnosed with pancreatic cancer, so we're finding ourselves, exposed to, going back and forth to the doctors and so on. And then I have to come back home to my children.
Right. Yeah, that's a very unfortunate situation. I apologize for you having to be in that. Unfortunately, we, even as healthcare providers, are truly limited in our gloves and mask content. For your mother in particular, who has cancer, definitely would fall under the higher risk group of patients that we are most concerned about. I would reach out to her doctors to see if there's any way that she can have any of her visits through telehealth or telephone visits, because oftentimes it doesn't really necessarily require her to actually be in the doctor's office, but perhaps they can call each other and get abreast of the current symptoms that she's feeling, and maybe limit the visits to the doctor to only the lab draws or the things that she needs. That doctor's office will most likely be able to give you at least a single mask for her while she waits in the waiting room. And a lot of the clinics, such as ours, Borrego Health, we keep our healthy patient population separate from our screen area. So one of the questions you might want to ask the doctor, which I'm sure they're already practicing, is are there special areas that I can take my mom where she's going to have a low exposure risk to any patients? Are you seeing patients that are being currently screened for COVID, and what can I do to protect my mom from going into those offices? But I mean, we're still struggling too for the gloves and the masks, unfortunately, and it really is an unfortunate situation for everybody. And I don't know, I don't have the best answer for you, but if you do go to a doctor's office and get at least one mask, or at least have a mask that can be sewn for you to protect her at this point, I would try for that.
Yes, Doctor, I've seen some medical professionals, actually one in Chicago, who was making makeshift masks. This is this is an embarrassment that we don't have a readiness for this pandemic with the personal protective equipment like masks. We need them not just for the healthcare professionals who are experiencing shortages, but we also need them for people like Araceli's mother. And so there may be other. These are not the best solutions, but they at least do something and give you some measure of peace of mind. But that suggestion of calling ahead to the doctor's office that you got to take your mother to, Araceli, I think is a good one. We have Doug from Riverside regarding the homeless. Doug, go ahead and ask your question.
Yes, sir, Congressman, and also Doctor. Thank you for taking these calls. Should there be a greater effort to address some of the homeless issues as related to this health issue, and yet provide shelter and needed mental health and substance abuse services, and also just assisting people in need?
Sure. Thank you, Doug, for that question. Doctor, I mean, I have some answers to this, but do you have anything to say about the need to take care of homeless people and how it relates to slowing down the virus spread?
Definitely. So homeless people are at risk if they're living in communities close together of spread, and then also access to care. So there is access to care in these federally qualified health centers. So I definitely think some sort of assistance needs to be done for homeless people to allow them to safely practice the social isolation. I don't know. I'll leave it to you as far as what the government's doing for that. But again, in times of need, when the homeless people do get sick, we do have federally qualified health centers that will be there, so they do have access to care. But truly focusing on getting them separated so that it doesn't become as pronounced of an epidemic amongst the homeless population in particular is something we need to focus on.
Yes, I agree with that, Doctor. Making sure that our homeless folks can also practice social distancing so that they don't contract the disease, don't contract the virus, and also that they don't spread it. And many of them do have mental health challenges. So, Doug, here's the thing. I do know that Governor Newsom has been securing hotels and motels. I can't say exactly which ones because there are some issues of a matter of privacy surrounding that. But that I know that even in Riverside County, they begin to secure places for the homeless to be housed and get them off the streets. That's number one. So, and I think we need to address two potential issues related to homelessness. One, we need to address people on the streets right now, people who are homeless. So we got to. So there's, as I said, the governor and the county are trying to secure places for homeless people to be housed. Secondly, we need to do homelessness prevention. We need to not have more people on the streets because they can't pay their rent or they can't pay their mortgage. And so what we've done through enhanced unemployment benefits, through the cash payments, the direct cash assistance through the rebates, the $1,200 rebates, that's all about trying to make sure that people can meet their mortgage payments and meet their rent payments. But in the $2.2 trillion bill that we just passed, we've got $4 billion set aside for grants for homeless people and folks at risk of homelessness. 3 billion people, $3 billion for rental assistance. We have in the bill a 120-day eviction moratorium at properties that receive federal funds. So if there's properties, apartment complexes that receive federal support, the federal government's imposing a 120-day eviction moratorium. You can't evict people during that time period. There's also a 60-day foreclosure moratorium on federally backed mortgages. So if you have a mortgage that's backed by the federal government, there is a moratorium on foreclosures. And I'm sure there's going to be more that we have to do. But thank you for the question, Doug, and it's absolutely necessary that we do address the homeless in a pandemic. Michelle from Riverside wants to ask a question of the doctor. Michelle, go ahead.
Yes, how you guys? Thank you for doing this. I appreciate you guys for this. Just for the doctor, I'm a in-home care provider, and I stay with my mom. She's 98. She's doing great, even before they have, made everybody want, be at home and all that. I've kept my mom home. We had stopped I had stopped taking her anywhere, and she barely would go anywhere too much. I mean, not that she can't, it's just that I just start keeping her home. But I have another client that's down the street from me, and I'm just wondering, is it still cool for me to just go ahead and go to my other client? I know they say if they're not sick with anything like the cold or anything, it's okay to still go. But since I do live with my mom, who's 98, I was just wondering, that's still cool. Would that still be a good idea for me to still do that?
Yeah, that's
Doctor?
an excellent question. Yeah, a very good question. So there's no correct answer for this. You do have to still work, so I would encourage you, when you do get home from your other job, to leave your shoes at the door, go right away to launder your clothes, take a shower before you hug your mom to prevent the spread. If your other patient that you're providing care for begins to exhibit symptoms, obviously then we would have to figure out a different plan at that point. But that would be my recommendation, is just make sure that before you have any contact with your mom after coming from a different place, that you do exercise extreme caution and just make sure that you're not contacting her at any point without changing and washing your hands and making sure if there's anything that you've hopefully rid yourself of it before contacting her.
So practicing very vigilant hygiene, washing of hands, probably staying 6 feet away from the person, her other client down the street. Would you say that, doctor?
Yeah, definitely. That would be a good suggestion as well.
Yeah. Remember, press 0 if you want to ask a question. Press 0. We have Angela from Riverside. Angela.
Hi, Congressman. This is Angela. Thank you very much for having this in a time where we are all so isolated. Having this kind of a town hall, I think, is kind of a lifeline, so I do appreciate it. My first question is, are you going to have more of these?
Absolutely. We'll be having more town halls. I will also be doing, posting Zoom conversations I have with local public officials. We'll also be having digital town halls. So stay in touch with that. These telephone town halls are actually somewhat costly, but right. we will do them. But the digital town halls are actually less costly. I think more people are going to be at home, so they can actually tune in. And and you have a question also about wanting to go to Easter services.
I do. So we've all been listening to the rhetoric over the last several days of, magically, I guess, somehow this is all going to just disappear and all the churches are going to be filled on Easter Sunday, I think it just gives a very rose-colored glasses type of thinking, and I'm wondering what your thoughts are on it and how you address that with your constituents.
Well, thank you for that question. Angela, I know that that faith is such an important part of so many of my constituents' lives, and that it's a source of strength. But I think, Doctor, you want to weigh in on whether you think that what are the experts saying about Easter being a time when we can take our foot off the gas pedal on social distancing?
Right. I mean, that would be amazing if it were to be able to come into fruition. Unfortunately, I don't think that that's going to be the case. I think that we're probably still going to be into the up peak of our diagnoses at that point. And yeah, it is difficult. I really wish that it could be solved as easy as that, and we're done by April. But I unfortunately don't think it's going to happen that way. So.
Yeah, that Easter's in what, 2 or 3 weeks now? Maybe 2.5 weeks, right? So, I don't see that in the cards because, Doctor, you said we're in the early stages of this, right? We're far from significantly away from seeing the peak, at least here in California. I mean, I'm hearing that New York, which is definitely further along in the sense of not a good way, may not peak for another 3 weeks, and we have to be cautious and make assumptions that we're probably underreporting the cases we have in states like our own.
Yeah, exactly. I'm on the same page as you. So I definitely think there are more cases out there that are going undiagnosed. And so I feel like it's still on the uptick. We can still make significant change if we adhere to the isolation and social distancing at this point. So again, it's imperative. And I know how difficult it is to stay home on Sunday, especially Easter Sunday when you want to go to services with your family. But it will be imperative if we're still on the uptick that you do that and practice spiritual hours at your house. You can still focus on faith with still being practicing your social distancing.
That's an interesting idea there, Doctor, that people start planning for Easter maybe through using technology like Zoom. You may not be able to get 1,000 people, and that same feeling and the music that goes along with it, and the singing and the experience that you have going to Easter services, or if you're Jewish and you want to have Passover dinner, you might have to have like virtual Passover dinners, right? Where you do the Seder in like 10, 20 different homes, but you're kind of on a conference call or something, or you're Zooming, or you're posting things, and so technology is, sometimes technology can make us feel alone, but in this case, if we're intentional, we can maybe use technology to mitigate or to soften the social distancing that we have to practice. And we have to kind of go in with this attitude, create the attitude that the fellowship, the sense of belonging that we experience when we go to religious services, that the greatest love and care we can show toward one another is to stay home. It's an odd paradox. It's an odd riddle, but it's I think being demanded of us. And as much as some people want to dismiss it, it's I think best to honor and respect the voices like Dr. Bulloch's and other health professionals, our scientists out there. Respect the scientists, people. All right.
Yeah.
Go ahead, Dr. Bulloch, you want to add to that?
Yeah, I just wanted to say, I mean, I don't mean to paint a terrible picture and make everybody even more panic stricken. We can really make a change if we adapt and adhere to these social distancing behaviors. And again, when you do start to feel that overwhelming temptation, like this is not good, focus on the things you can control. What can you do to control the situation? Can we control the number of people that are getting infected? No, but what can I do to help that? I'll stay at home so another person doesn't get infected. So really focusing on the things you can control can kind of help your mind become a little bit more at ease when this crisis starts to evolve.
Doctor, what I've done with some of my personal friends, I have a personal page. My friends and I, we've been posting, food we've been making at home, and I think that a lot of people are doing that. They're like, they've got time in their hands, they're at home, they can still go to the grocery store, and I call it COVID-19 comfort food. That people are, there's ways in which you can be creative at home and, be isolated but not be alone, right?
Exactly, right.
All right. So, if you have, I see that, my goodness, I'm afraid that we've reached the end of our time together tonight. Thank you to everyone who has listened or asked questions. And if you are still online to ask a question, you'll have a chance to record your question when the call ends. Dr. Bulloch, thank you so much for taking part in this discussion, and for all of you and your colleagues, all at Borrego Health and all of the other health clinics, all of the federally qualified health clinics, and all the clinics, all the hospitals, all of the nurses and doctors and technicians out there that are serving the public at this time to help those who are infected by this virus. There's no
question. Thank you, Congressman.
You're welcome.
Thank you for what you're doing for the constituents of the 41st District as well.
Yeah. Well, thank you. Thank you for your work. I know you're working hard, and you've taken time out of your schedule to be with us tonight. There is no question that this is a challenging time for our nation. People across America have fallen ill, and many have died. In California and other states, those of us who are healthy are being asked to stay home, to stop attending schools, stop working on jobs, stop seeing our friends, and in many cases, stop being paid. This physical isolation is hard, and the economic costs of it are real and severe. And I want you to know that while you are staying at home to fight the virus, that the medical professionals in our community are working every day to help the sick. Your elected representatives in California and in Congress are doing what we can to provide our doctors, our nurses, and you with the support that you need. The bill the House passes tomorrow will not be the last legislative action to help those impacted by the coronavirus. I will continue to work with my colleagues in both parties to identify new ways that we can help those impacted by this disease and help those who have lost income or jobs because of the coronavirus recession. I will keep fighting to ensure that our nation's veterans are protected from this disease and that the benefits they have earned are maintained. I will keep reaching out to my constituents, to all of you, to hear your concerns and to give you the best and most accurate information I can about the present situation. And I invite you to be in touch with us about the ways in which our legislation has left people falling through the cracks. I want to know about the people falling through the cracks. We are still many weeks from the end of this crisis. The most important thing that you can do to help yourself, your family, and your neighbors is to stay home and to stay hopeful. We are a people who can overcome any challenge and rebound from any blow, even this virus and the economic crisis that it has created. So, as we end tonight, I'm asking you to stay hopeful, stay optimistic, be optimistic. I'm asking you to stay safe and to stay home. I'm asking you to stay in touch with me at facebook.com/repmarktakano and at takano.house.gov. Thank you and have a good evening. God bless you all.